All right, sounds good. I'll have my baby
All
here.
right.
All
I
right.
think we're ready for you guys. If you guys are ready for us,
Yes.
good day, everyone. We are excited to be here. I know a lot of you had joined us for Liz's previous interview on cranial sacral, so we are super excited. I'm very happy to have you back today, Liz. Welcome.
Thank you so much for having me back.
Yes.
Yes.
And if you're out there and you're just joining us for the first time, Liz Lull is the owner of Enlightened Mama. And the cool thing is it's a business that we've worked together with a lot. And it's kind of funny whenever we see a lot of families in our office, and especially a new mom, we're mentioning different support options. And whenever we mention you guys, they're like, oh yeah, we already heard of them. So
Yeah.
it's pretty fun to know how well you guys have a great contribution to the community, and so many moms and families use you guys. So today we're going to continue on with some new mom resources, and especially around lactation and nursing. And especially so excited to be with Liz because that's one of her primary things. Not only a lot of certifications with the International Board, but even for the University of San Diego to teach these things. So very well qualified with her degrees. She also has 4 kids at home, so she has good personal experience.
You.
And
Yes.
then, of course, all the families in the community that you've worked with. So welcome, Liz. I am glad to have you on today.
Yeah.
And let's start. I know so many of the families that we see anyway are when the baby's born or they're getting ready for the baby to be born, the initial intent is to do nursing and breastfeeding.
Right.
And sometimes there can be some challenges right away or a little bit of struggles, but to help set the stage for the importance of it, because I know a lot of moms out there might hear it's important, but just to really know how important it is, what are some of the key benefits for
Yeah.
breastfeeding and nursing for your baby?
Yeah, and so it's interesting that we look at sort of like what are the benefits of breastfeeding, and also when we teach at the university level, we actually talk about the risks of not breastfeeding, which are kind of the same thing, but we have to be, we always want to be careful. We don't want to make people feel bad, but we do really need families to understand the importance of breastfeeding, not only for themselves, for their babies, for their partners, for the entire community. That I look at this as more of a public health issue. So there's a lot of the really common things that people know. Oh, breastfeeding is really good for my baby. It keeps him really healthy. So there's certain antibodies that are passed on via breast milk to keep babies healthy, which is really, really incredibly important. Also, we look at, they achieve a healthier look at that piece of it. But then we're also looking at preventing childhood cancers, things like that. So healthy in general, fewer ear infections. We also care a lot about structurally why this is so important for babies' jaw development, their tooth alignment. And again, you said we do cranial sacral therapy, so we have this whole big understanding of what happens in a baby's head, their cranium, their brain development that comes, yes, partly from the food that they're getting, partly from the fact that when a baby breastfeeds, and they're actually direct breastfeeding is what we call it, where they're actually on the breast, and this is highlighting the importance of actually putting the baby to the breast and not just giving them pumped milk, that will also change their palate, their jaw, their entire cranium is opened up. And when you have a nice big cranium, you have a room for a nice big brain. And so it's really important when we look at that. We also look at, when we have a baby at the breast, the interaction that takes place between the parent and the baby and things like that, and how important that is for their neurological development. So we've got lots of things super good for the baby. We also look at things as far as the lactating parent is concerned, looking at reduction in breast cancer, ovarian cancer, uterine cancer, heart disease, stroke, osteoporosis. Like our list just keeps going and going and going as we're seeing that again, these are all illnesses and conditions we're not supposed to get. And so if you have mammary glands, if your body was planning on breastfeeding at some point in its life, it was planning on lactating. And so we achieve our optimal health by doing the things that our body was, intended to do. And so, I don't always like to use that, like, that's what they're for kind of thing. I don't really like that mentality, but we do have to understand that from a health standpoint, if you have these body parts, your body was anticipating you using them. And so when we are lactating, the hormones that are involved with that, changes that occur within the body chemistry, the physiology impact our overall health, both in the short term and the long term. And the longer that you breastfeed, the longer you lactate in your entire life, the greater that protection is, or, that overall health is achieved. So there's that piece of it. We look at financial pieces as how much, it's relatively free. Like some people are eating a little bit of extra food, maybe, but overall breastfeeding is free. It's available. Also look looking at not the expense of just the food, but also the expense of what happens when you have a sick baby. So that's missed work. That's, that's maybe medications, that's treatments, that's lots and lots of things that we're looking at. And so this is why we have to look at it, I think, also not just from our own personal standpoint about what's good for my family, but what is good for the community when we know that billions of dollars can be saved every single year by families breastfeeding, even for a few months. Even if we can encourage some breastfeeding, we'll actually reduce a lot of these illnesses that land babies back in the hospital. And when we have people who can't afford healthcare or are using, some type of government assistance, which is actually most people, then we have to say, hey, this is something we should all be caring about. Like, how do we support breastfeeding for the entire community to keep all of our people healthy, to keep everyone's costs down? So this is where I look a little bit bigger picture, and again, I could talk about breastfeeding forever, but I do like to really highlight that importance for us all to be thinking that it is a public health issue and not just this is nice if you can do it because it's good for you, but it's actually really good for the entire human race.
Mm-hmm.
So
yeah, those are huge points. And even on the immune system side, I know the immune system, if you look in the manuals, it doesn't even turn on the first 28 days. So those first days, I know you mentioned antibodies right away. So that's part of that immune system being transferred from the breast milk to the baby. So they have zero immune system for 28 days. And then even over the next 2 years especially, like it's growing and it's testing and it's expanding to get some challenges and some practice in the real world. But in the meantime, the breast milk is where that immunity is coming from. So
exactly.
Such a huge piece that trickles down into so many facets.
Right, and we know that this is, the immune system is so much in the gut of a baby that if we can get it off to a good start, that's not just going to be childhood. That's not just, get you through the flu season during, when you're a year old. This is long-term longevity. How do we reduce inflammation in the entire body and have health overall? Absolutely. Just stemming from this, having the optimal food source from the optimal place at birth.
Yeah, it's always intriguing when you look at how nature's designed things, and if you follow that pattern, there's so many little reasons for it, right?
Right, so. Exactly. It doesn't screw up a whole lot. So this is a thing too. Is we're just thinking about remembering that every person that gets pregnant that has breasts, the breasts are planning on lactating, right? They kind of prepare for that. And every single baby that's born is intending on breastfeeding. And so it's just really knowing that this is kind of part of the design. And then we have to kind of get everybody else on board and get that support around it.
And that goes beyond. That was really intriguing when you talked about the cranial being shaped and how we just had some twins in the other day who were working on shaping their cranials or that's what the issue was, and it's like, breastfeeding is going to contribute to that, even though at first glance you wouldn't think it's going to impact things. So, what would you say some of the moms, when they're starting out, that they're either worried about, maybe even before they've started breastfeeding, or when they do start going, what are some of the concerns that parents have out there as new moms?
Yeah. I mean, I think almost everybody has a disbelief in breastfeeding and is this really going to work and how does it work? And so we say this is it's the biggest leap of faith that you ever take is breastfeeding your baby. And many people are really concerned about am I going to make enough milk? Am I going to have enough? Because it's really hard to measure when we can look at a bottle, we can put 4 ounces of formula trust breastfeeding, right? And so the things we teach are what we call about, signs of transfer. How are we knowing if the milk is getting into your baby? And so the biggest thing we look at output, right? So we say, well, if your baby is having output, if they're having urine and they're having stools, then that means that if something is coming out, that means something went in, right? So this is a really important thing when people are like, I gotta measure, I gotta count. Well, go ahead and count your baby's diapers. And we do that for a little while, or that's something that we do if there are issues or concerns. We look at weight gain, right? So is your baby growing? And does that mean that they've taken in food, right? So if they're pooping and peeing, they're growing. And then we also have to look at the baby's temperament and say, are they generally happy? Babies, of course, are going to cry and fuss, so we have to look at their temperament, and then we say, okay, then this is probably working. And so we can look at nuanced things, and sometimes babies will be having output and be sort of happy and not actually growing. And that's a really, big area of concern. Or we think, they're maybe eating enough, but not quite the output that we want. And figure out how do we improve that, and that comes from feeding. And so we teach about those things so that families can trust it. We also really give families a lot of education around the fact that you really just need to have enough milk for your baby. That there's this belief around breastfeeding that if I'm not pumping 20 extra ounces a day, I don't have enough milk. And we have people storing milk as if they're preparing for the apocalypse. It's like, no, you just really we want it actually to be even. We want you to be producing exactly the amount of milk that your baby needs, because having too much milk is actually a problem. That's a whole other subset of issues that we deal with when people have oversupply and clogged ducts and mastitis and all these things that come on from this belief that's put in people that you need to start pumping, you need to start getting as much milk as you possibly can. It's like, just how do we just get you and your baby acclimated? And we teach so much about how do you know by looking at your baby that they're getting enough. And gets back to those first points, right? Are they pooping and peeing and growing and generally happy? Breastfeeding is working. You have enough milk for your baby, right?
I think that's huge. I feel with so many moms, they have such an amazing motherly intuition. Mm-hmm. And so if you can just give them a few things to be looking for, then they don't get overrun by the analytical brain wondering, but they can really connect to that intuitive piece.
Exactly. Which is, I think, something that is so lost in the world of breastfeeding, the big struggles of not really knowing what to do. Am I holding the baby right? Am I doing this right? Is one of those most common struggles. And so we, look at the fact that we don't live in a breastfeeding society. And so we don't see it a lot. It's covered up a lot compared to other parts of the world where you see people are breastfeeding all over the place. Little girls witness this from a very young age, and it gets ingrained in their mind. And those are what are called the born breastfeeders. So when I ask people, hey, were you breastfed? Did you see siblings breastfeed, cousins, nieces? Was it around you? It makes it a heck of a lot easier to figure it out, to know, oh, this is how the baby should look. This is what, this is what is normal. And so when people don't see normal breastfeeding, they really, really struggle with that. So we have a lot of families in that situation.
Yeah, what along those lines, because I feel, it should be a more intuitive process, but if you're not seeing the intuitive way, what are some of the mistakes that you see new moms making?
Yeah, so one of the big things that we teach about is positioning and things like that and how to get comfortable. And so probably the biggest mistake that happens is that people they don't know how to get comfortable with their baby. And so we teach, there's this new phenomenon, which is not really new, called layback breastfeeding, right? And so it really involves getting comfortable and getting the baby in a more instinctive position and also a more instinctive nursing position. And I'll show you, it's really very, very simple. People think it's very complicated. So if you have a baby, right, and you can be sitting anywhere. So I'm just kind of sitting in this on my couch, right? And you only need to lean back far enough that gravity holds the baby on, right? And so we have to think about what makes the baby feel most comfortable. And I tell families, okay, your intuitive nature when your baby is fussing is to do what? And most of them will know, oh, I bring my baby here to my chest. Even, all parents will do this because this is where babies feel grounded and centered, and they now can use their instinctive behaviors to feed because they're little mammals. And so this is how all other mammals nurse their babies, is they lean back, they relax, they put their baby on their chest, and then the baby does the rest of the work. And so it doesn't have to be really complicated. Sometimes we'll have people get a pillow for arm support, or if you're out in public, use your diaper bag or something. A little arm support as that baby is developing and growing, but we're going to put a baby here. The baby's going to get relaxed. The baby is going to find their way to the breast, and then they're actually going to be nursing in this really instinctive position where the chin is into the breast. Breastfeeding in this more instinctive position. Now they're like, oh, this makes sense, right? And every single time families say, why didn't somebody show this to me before, right? And we are showing people, I don't care if they've nursed 4 babies and they come into our office, we're showing everybody this position because it makes more sense for me to be comfortable, for me to be relaxed, and then bring the baby there. And so what a lot of families are getting is what we call the grab and smash. And I'm sure people watching this will totally relate it, where somewhere along the line told you to grab your baby and grab your breast and smash the two of them together in order to get the baby on. And what that does, and I'm sure you can appreciate this from a chiropractic standpoint, if I'm shoving my baby's head on, what am I doing to their cervical vertebrae? What am I doing to their body, right? it's not a good, comfortable position. They're hunched over, and then we create all these other problems, and they can't figure out, why is the baby unhappy? Well, the baby also is falling onto their back. Babies have a startle reflex. They feel like they're falling and they're disoriented. Right. And so we say, now you just kind of ask your baby to have lunch while they're falling off of a cliff. It's not that easy to do. So we get you back, get your baby grounded, get you both comfortable, and then feeding goes so much better. And we do have to teach this and reteach this and teach it again, because so many people have it ingrained in their minds that I shove, I hunch over. I've got these nursing pillows, which are usually garbage, and people don't need to have them. They have a throw pillow. They have a pillow on their bed if they need support. So I think that's probably the biggest, thing that we fix in breastfeeding. And the thing is that it fixes almost everything. And we know if a baby doesn't instinctively go to the breast, then we have to figure out what's going on with this baby neurologically, that they are not able to tap into their instincts and their reflexes. And so that opens up this whole other element to look at, like, why is a baby not doing its instinctive feeding process? Because this baby was planning on breastfeeding the exact way that I just showed you. They weren't planning on all this other stuff.
Yeah,
right?
I think that's such a huge first step, because we see too all the time, if a mom has a newborn baby and they come in, there's all this tension up here because they're holding the baby, they're looking down, they're changing the diaper, the baby's so incredibly adorable, which rightfully so, all their attention is down all the time. So now if you add the nursing, the breastfeeding piece, also looking down and hunched over, it's so tough to recover and relax. So I think that's a huge first step, is mom's relaxed, baby's relaxed.
Right, and then you can
eat.
You
do that,
right.
Yeah, I picture holding myself from a cliff, and I'm not going to care about putting food in my mouth with the other hand.
No, and these babies will get mad, and then they're taught, oh, well, if the baby pulls back, push harder. But that's again, instinct. It's a reflex. If I push on the back of your head, you're going to pull back. And then the nurse or whoever will say, no, push harder. And then it's like, now the baby's mad, and eventually they'll eat. But it's not a.
Yeah. And I think that's so huge, because babies have so many reflexes, as you mentioned.
I mean, they don't.
Right, all those reflexes they have, they don't have this amazing muscular control when they're just born, so they're relying on the reflexes. And if they're crunched up, the reflexes might be trying to do something, but it's being inhibited, that natural movement and that natural ability. Yeah. So mom relaxed and baby relaxed, and then the reflexes can take over.
Works. Yeah.
Wonderful.
Yeah.
What are some of the other struggles? So once you establish that, what are some of the next things that you cover?
Yeah, I mean, I think, we are looking at a lot of what might be going on with the baby, too. So I think that this is a very normal, common thing. Lots of parents, lots of moms are like, oh, these are all my problems. And so we're looking to figure out, what is going on with this baby that might be causing the issue. And so we are always looking at the birth story as well. We're looking at, what happened to this baby, because breastfeeding is an extension of birth. And birth is an extension of pregnancy. So if we now sometimes have to go backwards and say, what was your pregnancy like? Which is really helpful to us to determine, yes, what's going on with the baby. But sometimes there are complications that come up. We want to know, did your breast change during pregnancy? Did your body get that message? Hey, there's a baby coming. I need to get ready for milk production. Were there any complications? Was the baby born early? That's going to change things completely, because that baby is underdeveloped in utero, and they're going to have specific challenges that we have to address and know. Then we look at, what was the birth like? Did we have interventions? Did we have a lot of IV fluids? Did we have, the baby's getting medications or separation, whatever it might be? Did you push for 3 hours, or did you push for 3 seconds and the baby just shot out? Because that's a whole other thing too, that babies can be really stunned, and figuring out what happened then, because then we can really dissect, what is this problem? Is it a temporary thing? And so we look a lot about both short and long-term outcomes from the birth story. And there's a lot of times families get so wrapped up, and they think maybe they were planning to have this unmedicated birth. They were planning to have a vaginal birth, and then it didn't go the way they wanted. And they think, oh, now I had a cesarean, I had an epidural, whatever. And they think they ruined breastfeeding, right? That baby might need to be supplemented early. They might need a little bit of extra food as their body is recovering from birth to get ready to make milk. And so those things can happen, and we have to say, no, your body will do this. We just need to maybe give you a little bit of help. Just like you need a little help to get your baby out of your body, we might need a little help with breastfeeding, but that doesn't mean that you can't go on to successfully have lots and lots of milk for your baby. It just means we need a little healing to happen.
For sure.
So it's happen a lot.
Nice as a new mom to have that permission that it's not an all or none thing. And we see that a lot
Exactly.
with families where they need a little bit to get going, get things figured out, and it doesn't
Yeah,
have to give it up entirely.
exactly. Exactly. And I think that, that's the thing, both in the short and the long term, that we have lots of people going back to work or getting really kind of far in their head about thinking the baby's only 2 days old and they think, oh my gosh, I have to go back to work soon. And how do we kind of help bridge that gap of the stress that comes with going back to work and getting breastfeeding off to a good start so that you have the milk production so your baby gets really good at nursing so they like doing it. To lay that foundation is really, really important in those early days and weeks.
For sure. What
Yeah.
do you see also, because I know in our office we'll see things mechanically with the baby's jaw, their neck, their cranials might be off.
Yeah.
Can you talk about that a little bit? Because I know with the cranial sacral, then that'd be something that if everything's going perfect, you have a good position, everyone's relaxed, you have enough supply, and then it's like baby's trying, but maybe they're getting kind of extra air, or feel like they're not getting enough. It could be the mechanics of the baby. What have you noticed
Absolutely.
with that?
So it's a really fine, intricate thing that a baby has to do to be able to remove milk from the breast. And so they have to bring their tongue over their gum line. They have to take their tongue and cup and groove and hold the breast in place. And then they need to take their tongue and make this little wave-like motion where it pushes the back of the tongue up against the roof of the mouth, and that compresses the breast to push milk into their mouth. And then they have to have their lips flared, their top and bottom lips flared. And so that's a really intricate process that has to happen. And so what can happen, sometimes there's restriction, and we see a lot of babies with tongue and lip ties, which is a really, I don't want to say it's a popular thing. It's a common thing that we're seeing because it does pose issues with breastfeeding. So we'll see that, some kind of oral restriction, but we always want to figure out, is that restriction coming structurally from the anatomy, or is it part of that cranium that's pulling on the baby's head or neck? And so it's really interesting. I literally just had a baby that left here about 15 minutes ago that had seen them. Yeah, there's a little restriction in the baby's lip, but not really the tongue. The mom was having some pain. And then we just couldn't get this baby's jaw open. And then I just did a little work and actually adjusted the baby's temporal bones. And then all of a sudden, whoop, the baby's mouth opens right up like that. And so then I give her some exercises to see, I started this process, but you're going to keep finishing it, because this baby's jaw was very, very tight. And so that's where we're always looking to figure out, is this anatomy? Is this functionality? Is this something that we can do some suck exercises with? Can we, we do body work, we make referrals, to you guys, but also are teaching families lots of stuff to do themselves to figure that out, because it's definitely so, so important. And then we do see issues where babies are getting more bottles, babies are getting more pacifiers, and they're getting very narrow in their latch, and then they have a harder time on the breast. And so we do want to make sure we try to get breastfeeding going really well before we introduce bottles and things like that, if possible, because that will change the structure of their mouth. So,
okay. Do you have preferred timelines before introducing those?
Yeah, usually like for a bottle, definitely we can get a month. 4 to 6 weeks is good. Sometimes it just depends on families who are going back to work at 6 weeks. We might say we want to go to 4 weeks. If you're not going back to work for 12 weeks, then let's get it to the 6 week mark, and really just want to make sure, especially that baby has their oral skills down and that they are liking breastfeeding and good at breastfeeding. And then those are the babies that will say, like, I'll tolerate a bottle, but I like breastfeeding. And so that's kind of the goal, that we want people to really have honed in their breastfeeding skills. And certainly sometimes we have to use bottles, and we use pacifiers earlier on than that, but that would be kind of the ideal.
Mm-hmm. Yeah. And I think, there's always an ideal, but in the real world, there's so many variables, so many things to consider, that I think it's nice to know at least what you're moving toward, and know that if you can't quite hit that, what the other options are. So.
Exactly. Yeah, or sometimes we'll see babies that are born really premature. They're in the NICU, in the intensive care unit, and those are babies we say, hey, we actually want this baby to get a bottle so that you can get out of the NICU, so you can get home and they can grow and get stronger, and then we can work on breastfeeding, because they may not have all of the skills and the ability and the strength to work really hard at that breast like we're trying to get them to, but they can get there. And so sometimes just giving people that peace of mind of, like, meet the baby where they're at, and they might need a little help now, but then they can really develop those skills as they get older.
Definitely. Yeah. Okay. So as we're closing up here, are there any other major things that you see as either a common mistake or an easy to implement or overlooked tip that you like to give moms?
Yeah, I mean, I think a lot of this just goes back to having really good support put in place. And I think I mentioned, these people who've never seen breastfeeding, we call it being like raised in captivity, is like kind of like into these stories about animals that were raised in the zoo and didn't actually see other monkeys like raising their babies and feeding them that actually struggled. And so we see a lot of people who are kind of just raised in captivity that have never seen it, don't know it. So find friends, find a group, find a support where you can actually look and watch people breastfeeding, that if you haven't ever seen it before, prenatally you have to watch breastfeeding happen. And I've had, I had my kids when I was young, and so I had all my girlfriends were like, can I watch you do that? It's like, yeah. After you've given birth, you kind of don't really care. And so it's really that it's such a teaching thing that we have to share as a community of parents. So looking at that, looking at where do we find support after you've had the baby is. But we see a lot of people, I think they just kind of trust what they hear in the hospital. They trust what they read on Facebook. And so we have to be careful when the support is maybe not what instinctively feels right to you, to find other support, because just like there are lots of different doctors, there are lots of different dentists, there's lots of different chiropractors, right? There's we all have different style. And so it's really important that if families are getting support that doesn't feel like it aligns with their values or what their goals are, to know that there's more support out there. That we see lots of people that way, like, oh, I've seen 6 other lactation consultants, or my nurse told me this, or my doula told me that, or whatever. It's like, but what feels good for you? And so trying to help families trust the instincts. Another big mistake is reading too many books. So, don't read books. Careful about apps and those things, which can be really helpful, but also to know that every time that you're on Facebook or every time you're looking at a blog to try to solve your problem, you're not looking at your baby to try to solve your problem. You can get some resources, but really what's going on here. Every time that you're on the app or the thing, it's taking you away from your baby. So we like to find a balance of
and that's why I think it's so great to have some resource like yourself, where it's an outside perspective, seeing mom and baby interact in that moment. Right. So now you have that set of eyes who's a professional who's seen so many interactions. Right. And it's just like having a coach in anything. When they can look from the outside perspective, it's like, oh, you're so close. Let's just do this little tweak. Perfect. Yep. And much easier to solve than the app or the book.
Exactly.
When do you recommend as a resource families contact you when they're looking into lactation? Do they do it during pregnancy, once the baby's born?
Yeah, I mean, we do both. So we do a lot of prenatal consults for people who have had previous struggles that they just want to get a plan in place. So we do prenatal consults for that and just kind of get them off to a good start. Sooner rather than later. I mean, I feel like if I can see someone after, the first few days is great, just to kind of figure out, is there something going on with the baby? Let's talk about your birth. Let's make sure that you're off to a good start. So I feel like it's one of those things, if you think that you should call somebody, you probably should. I look at we do home visits, so we can come to the hospital too, even if you're not liking support you're getting there. It's sort of like that, ounce of prevention is better than maybe 25 pounds of cure, because when they're coming to us at 6 weeks, and then it can be more of a challenge of oh wow, and we'll see babies that are a year old or 2 years old. It doesn't really matter. We can still solve the problems, but easier sooner rather than later is what I would say.
Absolutely. If you have that opportunity, and how you all the benefits that you described to begin this webinar, that there's so much that can be impacted. So if you can get a good early start with that,
exactly,
it's so huge. And also, when a baby's young, their neurology is young. So every day they're programming new things into their brain and their neurology. That's why it's so crazy. This weekend they couldn't do this. Now they can. Right. So the sooner the better. Absolutely.
Yes. Before they get too much of an opinion, it's usually good. Right. Right.
Yes, even at a young age, they do have their opinions.
Good.
All right. Well, wonderful. Thank you so much, Liz. And we'll put your contact info in the bottom, like we did last time.
Yep.
So people definitely recommend reaching out, whether it's early, whether it's you've been working on things for a little while. A wonderful resource at Enlightened Mama. We're so happy to have you again today.
Thank you so much.
You bet. We'll talk to you guys soon.
All right. Bye-bye.
Bye.